Good morning. I'm Twila Brase, President of Citizens Council for Healthcare, talking to you live from Washington, D.C. for the first time ever. And I'm hoping that you can see the Capitol in the background there. So, although I think now all I can do is see me. Oh, here we go. There's a better view. Anyway, thanks for joining in, who's ever here. It is a chilly day in Washington, D.C., but there's certainly a lot of activity happening here. We are right behind the Capitol rather than in front of the Capitol, as I thought that would be easier. And now, since this is the 7th anniversary of Obamacare, just a reminder about what President Obama promised 7 and 8 years ago when he was promoting Obamacare. If you like your doctor, you can keep your doctor, period. If you like your health plan, you can keep your health plan, period. Well, we know now that that wasn't true, never was true, never was going to be true. They knew it all along. And now what we have here in Washington is a plan for the Republicans on this day, the 7th anniversary of Obamacare, to replace Obamacare. And the bill, unfortunately, is not a repeal. And from what I have been hearing in the days that I have been here, is that they're not actually even sure that today is going to happen. They're not sure that there's a vote that's going to happen. They've been negotiating all night. We've been hearing different things. You perhaps saw it in the news when it comes to, if it ever gets to the Senate side, that Senator Mike Lee from Utah says that the parliamentarian hasn't even been asked, what the possibilities are to expand the repeal into the regulations, repealing all the Obamacare regulations. And so it looks like, somebody told me that they have been working on this for a year. But one of my concerns has been, have they really talked to the conservatives? You probably recall that President Trump brought in the conservatives, 6 conservative organizations, 2 days after the bill was released. But, were they brought in ahead of time? It doesn't seem like it. And then the Freedom Caucus, they seem to not know what the bill was in and have been opposed to it. There are different members of the Senate, like Mike Lee and Ted Cruz and Rand Paul, who have been opposed to the bill. They don't seem like they were brought into the discussion for that year, if indeed it truly was a year. So this is an interesting time to be in Washington, D.C. I will say I've been here many years, at various times during the year. I've never quite had a year like this year. You can tell, I think I'm going to call it Trump traffic. You can tell that Trump is around, because never has the traffic been stalled more. I was in a taxi yesterday waiting at an intersection for 10 minutes while the police made sure that they cleared the entire intersection. There have been helicopters flying overhead above my hotel room. So this is a time when Trump and Pence are here trying to get Republicans to actually pass this bill, which is not truly a repeal, which really could be, once the Americans figure out it's not really a repeal, they figure out that the health plans, there's no guarantee that the health plans will lower the costs, no guarantee that the health plans will widen the networks. There's still in the bill no repeal of the prohibition on catastrophic coverage, true health insurance. So when Americans find this out, they'll realize that the Republicans haven't really repealed Obamacare. I think that the Republicans should really try harder. I've been here on behalf of Citizens Council for Health Freedom, just telling them what our concerns are about the bill and giving them new ideas. For instance, an executive order to let people out of Medicare so that we would start to build a health insurance product that would be lifelong. Or how about parents being able to offer or buy policies for their children pre-birth, so we could get away from the whole thing about pre-existing conditions. Give tax equity to people. Get away from employer-sponsored coverage so that everybody can just own their individual policy and keep it for life. So these are some of the things that I have been offering. Now I'm just looking at my notes here. I wanted to say that Representative Thomas Massey from Kentucky said about the bill, the American Health Care Act, right? He said about the bill, we've replaced penalties and mandates and subsidies with penalties, mandates, and subsidies. He said that to Greta on MSNBC. He's not happy with this bill that that the Republican leadership wants to pass today. Nancy Pelosi is trying to drive fear into the Republicans by saying if they pass it, it's going to be tattooed to you. Well, the Republicans really have to make sure that the Obamacare and everything that looks like Obamacare remains on the backs of the Democrats in order to eventually get the Democrats to come up alongside them and do a real repeal of Obamacare, and then send health care back to the states and to individuals. I will say here that I've heard it's very unclear that anything is going to happen today. It's been changing by the minute. They had a 13-hour marathon of negotiation yesterday. One person told me the vote may not happen. As you know, the Republicans have gotten in charge the way they have because of 3 years of telling people they're going to repeal Obamacare. So they've gained governorships, they have gained the state houses, now they've gained the U.S. House, U.S. Senate, and the presidency. So now is the time for Republicans to do what they said they did and the reason why they got into the power that they are in today. Just look at my notes here to make sure some things that I wanted to tell you. Oh yes, so they're making amendments, and one of the amendments, and somebody who used to work here in Republican research, one of the amendments actually did something, he says does something that they don't even know, is that it would obstruct 7 million veterans from having access to the subsidies that they say they want to give everyone. That's just one thing that was found, and his question is, what else is there in these amendments that are so-called technical that will be found later? We do not want to get into a situation where, like Nancy Pelosi said, you know, we have to pass the bill to find out what's in it. Republicans shouldn't do that, and it's really easy if you just repeal Obamacare to know exactly what's in it. 2,700 pages and more than 40,000 pages of regulations and guidances all disappear. That's easy to know what's in it. HHS Secretary Tom Price, as a congressman, had a bill that had 56 words in his repeal. It'd be so easy to read, you know exactly what it does, and then give control back to the states and to individuals so that they can do health insurance the way they need to do for their people. We don't need another federal system. That's what I've been telling them. I don't think that a lot of the people watching this today want a federal system. I will tell you, I'd probably say something to your comments. I can tell that there are comments. I can see little things going by. But because I'm out here in the bright sunshine, I can barely see myself on the screen, so I can't see the words that you're saying. I'm hoping that this will be a good Facebook Live presentation for you. Yesterday I asked somebody about the catastrophic coverage provision because, as you know, we have the wedge of health freedom at jointhewedge.com, where we're trying to build a system outside the current system where the health plans control and the government controls. And they agreed that the repeal of the prohibition on catastrophic coverage is not in the bill, and they're hoping that the administration will do something. But really, this is such an essential element. 6 million people had this before Obamacare took it away from them. Everybody really should have this kind of coverage from birth to death. So we really have to repeal this prohibition and get back to true competition. One thing that I have suggested to members is that, you know, the health plans have so much power. Why not just give catastrophic plans tax exemption for several years, maybe 5 years, to get them up and running and to compete with the health plans that have all this power. Whatever we do, we have to really disempower the health plans, who are really the problem and not the solution. And right now, that bill doesn't do it. Obamacare puts the health plans into power. And so what you see from this bill that they're hoping to pass today, the leadership is that it's not a repeal. And voters really understand a repeal. I don't think that the Republicans have really tried to do a serious repeal. They're talking about 3 stages. 3 stages is no guarantee of anything. And so I would stand here and answer your questions, because some of you probably actually have questions, and I would answer them, but unfortunately I can't see them. So I just thank you all for tuning in today. I'm glad it is this kind of day rather than a rainy day, or yesterday when the winds were blowing 30 miles an hour and it was absolutely frozen out here. So enjoy the view. Let me just give you a little bit of a view. This is again from behind the Capitol, so you can see all the people gathering. And then I'll just turn this around, and then through the trees you can see the Supreme Court building, and over there is one of the Senate buildings, and here's an elevator to go down. So here we are back here. So again, I'll stand on this side. thank you so much for tuning in, and I appreciate, for those of you who support our organization, I appreciate you supporting what we do and giving us the opportunity to be here and to really make a difference. I should tell you as well that Ginny Thomas did a video of me for the Daily Caller. It will be online for sure by Sunday and maybe before Sunday. So if you want to hear some more about what I told her and her questions, feel free to tune in at the Daily Caller News Foundation and take a look at the video. Again, thanks so much for tuning in, and now if I can find the button to turn this off, I will, if I can actually see it. So, thanks again.